good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth. Tonight I'll be your host for our program on ENT problems. We're ready to take your questions about everything from hearing loss, persistent scratchy throats, to any ear, nose, or throat problem that might be worrying you. Please take a moment to call in your questions locally at 218-788-2844 or toll free at 1-877-307-8762. Now I'm happy to introduce this evening's panelists. Dr. Todd Freeman, an ENT specialist with Northland Ear, Nose, and Throat Associates in Duluth. Dr. Jonathan Glickstein, an ENT specialist with Essentia Health-Duluth Clinic. And Dr. Victoria Heren, a family medicine physician with the Raiter Clinic in Cloquet. Our medical students answering phones tonight are Sarah Frisch from Wheaton, Minnesota, Leah Kay from Dassel, Minnesota, and Laura McDowell, who's from Hastings, Minnesota. And now on to tonight's programs on ENT problems. Well, Dr. Freeman, one thing that at this time of year we always wonder about is, does weather affect sinus troubles at all? It seems like everybody has sinus complaints.
Well, I think we tend to think more when people have more seasonal issues that it's probably more allergy mediated, but certainly allergies can trigger sinus issues. But if someone's pretty consistently having problems the same time of the year, year after year, I think we tend to believe that's more allergy mediated than necessarily weather mediated.
Well, thank you. Dr. Glickstein, I know someone who's going to be having surgery on their sinuses. I mean, is that something that's done very often, or is that kind of in the extreme cases? Or?
That's a good question. There are a few different indications for sinus surgery. One can be frequent infections that occur and don't respond to antibiotics or other treatment. Typically speaking, you're going to want to have probably 4 to 6 acute documented infections within a year to even consider that sort of therapy. Other reasons could be chronic or long-standing inflammatory conditions within the sinuses that could be diagnosed on CT scans of the sinuses. And then patients would also have to have significant symptoms, whether that were difficulty breathing through the nose, facial pressure or pain, diminished sense of smell, and then often drainage.
But just the CT by itself, would it really necessitate surgery? It's if they're having symptoms too related to that.
Yeah, typically not. I mean, as one of my teachers once said, you don't operate on CAT scans, you operate on patients. And so often there's a quality of life that really needs to be addressed and or assessed prior to recommending surgery.
Thank you. Dr. Heren, I certainly see a lot of patients with sinus troubles and sinus infections in my practice. Do we always have to give antibiotics if somebody has a sinus infection?
Most antibiotics don't have much effect on sinus infections because a lot of them are viral. There was studies done, people actually volunteered or got paid to have needles stuck up in their sinuses and the stuff up in there taken out and cultured. And it was the minority of cases that they grew out bacteria.
That's
and since
interesting.
antibiotics only work on bacteria, most sinus infections won't get better.
Thank you. Dr. Freeman, since we're on the sinus issue, we're talking about surgeries. What kind of surgery is done for sinuses?
Well, in the last 20 years in the United States, the whole theory behind sinus surgery has changed drastically. And traditionally, our surgeries would be directed at ablating or destroying the offending sinus, and because we thought people developed irreversible disease. And modern sinus surgery is done with scopes and limited fields of surgery, sometimes small balloons, but it's all designed now to establish ventilation and drainage. And if we can get these sinuses that we formerly thought were irreversibly damaged, if we can get them draining and ventilating, then a lot of times the chronic inflammatory changes will reverse and resolve a lot of symptoms. And the newer surgery is much more comfortable for patients to undergo as well.
Good. Well, thank you. Dr. Glickstein, we have a caller from Duluth. Was wondering about tinnitus. He was told there's no real treatment for tinnitus, but now he keeps seeing it in advertisements.
Sure.
Can you comment on that?
Sure. So while there probably isn't a cure for tinnitus, often there are treatments that can be effective. One, which is very easy, is turning on a fan or having some sort of distracting noise if you're having difficulty sleeping at night due to the tinnitus. Other things that you can do would include, there are vitamin supplements which can have a bigger benefit than just placebo. Lipoflavonoid is one that I can think of that has a study to back it up, even though that was particularly for Meniere's disease. It's something that one can try with minimal side effects.
Is that over-the-counter type of thing?
It is an over-the-counter vitamin supplement, and there are other various commercially available supplements. Moreover, if someone has significant hearing loss, often providing amplification for the patient can reduce the symptoms of tinnitus. And if the tinnitus is extreme in terms of causing anxiety or causing sleeplessness or other symptoms, we can do behavioral feedback or biofeedback treatments where we try to condition the brain not to respond as much to the sounds that are occurring.
Well, thank you. Dr. Heren, a caller from Duluth, wants to know, can you explain the cause of vertigo?
Ooh, well, there's more than one cause of vertigo. A very common cause of vertigo comes from the inner ear, which you cannot see from having somebody just look in your ear, but it's from the inner ear that's in your skull, and you can get some swelling of the fluid in there, little stones in there, that it sets your internal gyroscope haywire. And until the extra fluid goes down or the stones get settled down, your body doesn't know which way is up. It's like being seasick without benefit of being on the boat, because your inner ear is moving even if you're not. So inner ear disturbance is one of the major causes of vertigo, be it little otoliths, or sometimes we'll blame it on a virus causing swelling in there. And there are things you can do about that as well in terms of positional treatments, keeping your salt intake down, and some medications can help at times too.
Thank you. Dr. Freeman, a caller from the Iron Range, would like to know, are there any remedies for snoring? You must see some patients with snoring now and then.
I see a lot of patients with snoring. There are a few things that can be effective, but they have more to do with lifestyle changes. Really, if you look critically at the literature, there's weight loss, and then weight loss as your primary things that can reduce snoring. And then other than that would be avoidance of sedating substances like alcohol, sleep aids, pain medicines, muscle relaxants, things like that will tend to make you snore more. Establishing a very regular sleep cycle so that you're going to bed the same time, up the same time every day. You have that very consistent sleep cycle. It tends to improve your sleep hygiene so you sleep more efficiently and snore less. And then finally, regular exercise, where you're aerobic exercise, where you're getting your heart rate up. We don't understand why, but it does something chemically. We believe in your central nervous system that improves your sleep efficiency. Its effect is independent of the weight loss phenomenon.
Thank you, Dr. Glickstein. A caller from Duluth wants to know about taste or smell. He says, is there a condition when everything smells the same or tastes the same, or maybe it's loss of taste?
Yeah. So clearly, anosmia or lack of sense of smell can diminish someone's perceived sense of flavor. But the sense of smell and sense of taste are actually independent. One of the more common reasons for loss of sense of smell can be a viral infection that causes damage within the nerves, and that can be irreversible. Often quoted improvement rates are in the 30% range if someone has complete loss of sense of smell after a viral infection. Something like Zicam, which was previously available, a zinc-containing nasal spray, which was touted for the common cold, actually was associated with nerve injury, and so clearly that's discouraged. Moreover, things like the common cold or chronic sinus inflammation can prevent mechanically the little molecules from getting to the very top of the nose where the smell nerve is located. If you have that problem, it is actually important to get that evaluated because there are personal dangers to you, missing spoiled or contaminated food and eating them unwittingly, or even being exposed to gas leaks. So it's important to have that problem assessed.
Thank you. Dr. Heren, a caller from Cloquet would like to know, what is epiglottitis?
Ooh. Epiglottitis is a quite serious disease where your epiglottis. What's your epiglottis? It's a piece of tissue you have in the back of the throat that kind of flips back and forth, so when you're breathing or swallowing, things will go down the right tube. You can get a infection in that will cause it to swell, and since it's right where you're breathing, if it swells too much, you can kind of stop breathing. So it's a serious infection. It often occurs in younger children.
Can be an emergency type of thing?
It can be an emergency thing, and you're sick. You know you have a sick child. It's not just a minorly ill child. You have a sick child who is leaning forward, drooling, not breathing very well, high fever. It is a rush to the emergency room.
Sounds scary.
Yes, it is. Scary for the parent and scary for the doctors. It is treatable, though.
Well, thank you. Dr. Freeman, I have several questions here regarding tonsils. One from Grand Rapids, one from Duluth, another one from Cloquet. I guess I could summarize it as, when I was a kid, everybody had their tonsils out darn near, and then it went for a while, nobody had their tonsils out. So are they still taking tonsils out in patients?
We are. The pendulum has kind of swung to the middle a little bit. The criteria are pretty stringent when it comes to recurring bacterial infections. It's based on the number of antibiotics you're on, and the latest criteria that were put out by the National Academy of ENT Doctors was 7 courses of antibiotics in a single year, 5 a year for 2 consecutive years, or 3 a year for 3 consecutive years.
That's quite a bit.
That's a lot. We probably take more tonsils out just in children at least, for obstructive symptoms than we do actually for infectious symptoms these days. And in those cases, you're seeing kids who are snoring a lot, but in addition to that are actually obstructing during their sleep.
Sure.
Or they're having swallowing problems as a result of the big tonsils, or it affects their speech, their quality of speech. Sounds like they have a mouthful of mashed potatoes.
Sure. And in the same region are the adenoids now. Do you take, a caller wanted to know about taking adenoids out. Does that help snoring, or are adenoids taken out also?
Rarely do we do it just specifically for snoring. We'll take out an adenoid as an independent of tonsil surgery for chronic nasal obstruction, sometimes children with sinus disease. It'll be a first-time thing we'll try surgically. Those are the main reasons, or for chronic or recurring middle ear disease.
Thank you. And one last tonsil question. A caller from Duluth wants to know about stones in the tonsils. What do you do with those?
Very common in people. We see people, daily who have debris or stones that form in their tonsils. They can be, they like about the size of a cottage cheese curd, and they can smell and affect breath. The stones themselves are not an indication for surgery. If you have chronic pain that accompanies the stones, then oftentimes they can be considered for surgery.
Thank you. Dr. Glickstein, there's an interesting question here, a caller from Duluth. He has pain and a cracking sensation in his ear. He's been on antihistamines, decongestants. His dentist doesn't think his teeth are causing the problem. Anything that ring a bell at all?
If the cracking is occurring from opening the jaw, one would consider temporomandibular joint dysfunction. I suspect that the caller is referring to the dentist not thinking his teeth are causing it. Hopefully that part of it's been evaluated. People can have eustachian tube dysfunction, which is the tube that connects the back of the nose to the air bubble behind the eardrum. And if there's a cracking sensation often associated with with swallowing. That can certainly, in some select patients, also be accompanied by pain, although eustachian tube dysfunction is not typically painful. There's the possibility that there's some sound, whether it's musculoskeletal, some sort of muscle or tendon that may be close by, that may be rubbing. And so things like calcification of ligaments and the like could be causing it, but certainly a physical exam and then a detailed explanation from the patient might be helpful.
Thank you. Dr. Heren, a caller from Duluth wants to know about, he gets a nasal drip while he eats and wonders if it's related to her diuretic medication. Does that sound familiar at all?
A runny nose while you eat, unfortunately, is a fairly common complaint, and it is not related to medication usually. It's more a condition that people get sometimes, especially as you get too many birthdays. It also,
Oh yeah, there's a lot of that going around.
yes, also can be related to what you're eating, especially hot or spicy foods. Anything that is irritable can kind of make your nose run. But for some people, it's just eating, and really does not matter which medication you're taking.
Thank you. Dr. Freeman, we have a caller from Highbridge, Wisconsin. Oh, she's asking a question I'd like to ask too. Is a neti pot treatment beneficial? What about neti pots?
Absolutely is.
Oh, it is?
It absolutely is. Salt water is wonderful for your nose. And I don't think the neti pot specifically is magic. It's just saline or salt water. And you don't have to buy it. You can use tap water that you add just a non-iodized salt to. But the CDC recommends you boil tap water before you use it as an irrigant. But saltwater irrigations in your nose, whether they're a forced flush or a gravity feed like a neti pot, it really doesn't make any difference. It's just the fact that you're getting salt water in there. It helps a lot with inflammation. It helps the ciliary motion and the movement of the mucus. It changes the character of the mucus. It helps with chronic, helps allergy sufferers, chronic sinus disease sufferers. It's a old remedy, but it's a wonderful thing that has withstood the test of time.
Terrific. I'll have to dig mine out of the closet, I guess. Okay. Dr. Glickstein, here's a caller from Duluth would like to know about a deviated septum, and does it cause breathing problems?
A deviated septum is a displacement of the cartilage and bone that separates the two nasal passages, the left from the right. If a deviated septum is severe enough and located in the bad location, which would typically be further forward in the nose, it can cause difficulty with breathing through the nose. The ironic thing is that the other nasal passage, which has more room, often becomes filled with a structure called the inferior turbinate, and so there's the net effect of blocking both nasal passages.
Thank you. Dr. Heren, you're our drippy nose specialist tonight. So we have a caller from Duluth wants to know, is Nasonex good or bad to use for a drippy nose?
Okay, that's a kind of general statement, and I'll give you a general answer that in general, yes. It's a topical steroid. It helps reduce inflammation, and very often the reason your nose is dripping has to do with an inflammatory result. Actually, if it's an allergy, it can help a bit too in soothing down the allergic response. I can envision there would be times when it would not be a good answer, but in general, yes, definitely.
Well, thank you. Dr. Freeman, a caller from Esco, would like to know about Zenker's diverticulum, and is there some procedure that can be done for that?
Zenker's diverticulum is a pouch that forms high right as your pharynx joins your esophagus in your mid-neck, and usually it extends posteriorly off your esophagus. And as they get large, people can trap food or pills in them, and they can really compromise their quality of life. But it can also be a risk to people if they get bad enough that patients start losing weight or have recurring pneumonias because they aspirate. They'll aspirate stuff later into their lungs from there and can cause pneumonia. Then it becomes a more dangerous situation. And there are some indications when we will operate on them. Traditionally, it would be done through an external approach, an external operation. We now have special scopes that we can do them endoscopically. It's a much simpler procedure, and people are drinking pretty much clear liquids right away and returning to diets fairly quickly afterwards. So if they're significantly symptomatic, yeah, they can be addressed surgically and really dramatically improve a patient's quality of life and make things much safer for them as well.
Dr. Glickstein, we have a patient from Bayfield calling, wondering about a salty taste in their mouth. Does that have any comments on a salty taste?
Sure. A persistent salty taste, although I'm sure this is probably not their concern, after head trauma would be concerning for some sort of cerebral spinal fluid leak.
Oh, sure.
But I think that most likely the patient's describing a concern about a change in taste. And there are all sorts of reasons why that could be the case. Vitamin deficiencies certainly could come into play. It could be a medication side effect, because there's certainly a lot of medications out there that can alter the sense of taste directly or indirectly by drying the mouth out. So certainly taking a detailed history, I think, would be important to trying to figure that out.
Thank you. Dr. Heren, this is a slightly bit off the topic, but it's a good question. A caller from Cloquet wonders about polymyalgia rheumatica or even temporal arteritis. Can you explain that a little bit?
Okay, shifted gear. It is in the head. It does affect that. It's a type of vasculitis, inflammation of the blood vessels. It typically hits in the temples for temporal arteritis, can cause headaches, and the really bad part about it is it can cause blindness if it cuts off the blood supply to your eye, which is very bad, and it can do it suddenly.
That's the temporal arteritis.
That's the temporal arteritis part. And I guess I'm not sure where they were going with that, but it does affect your head and neck.
Sure. Well, thank you. I think that's kind of what they're probably looking for. Doctor, we just have a couple of minutes left. Dr. Freeman, what about a geographic tongue? Is that something, what is it, and do we need to do anything about it?
It's a relatively common condition. A lot of people will have it and not even be aware of it. I'm sure we'll kind of run to the mirror and check after we talk about it a little bit. But you get patches of apparent inflammation on your tongue, and it can change from spot to spot on your tongue. And people can get nervous about it. They'll have cancer fears and stuff. It's something fairly common in the ENT office we see, and really our main role when we see patients with it is just reassurance.
Sure.
There's no specific therapy that's going to help. People just need to be reassured that it's not a precancerous condition. It can look pretty ugly, and people get nervous about it, but for the most part, we just reassure people about it.
Thank you. Dr. Glickstein, a caller from Elborn wants to know about surgery for sleep apnea. Is that done sometimes if the CPAP isn't working?
Yeah, it's a very thorough conversation that needs to occur. Trying to figure out why the CPAP isn't working for the patient. If it has to do with the fact that they can't tolerate having a full face mask on and are otherwise not going to wear the mask after a good faith effort, then there are surgeries that can be done. I will say, though, that CPAP is certainly the gold standard for treatment, meaning it's the most effective as the studies show. However, there are some surgeries that can be done, whether it's to improve the breathing through the nose, whether it's to widen the throat by removing tonsils or palatal tissue, or possibly even increasing the room at the base of the tongue by doing selective removement of lingual tonsils.
Interesting, okay. Dr. Heren, it's probably one of our last questions here. Patient who has an obstructed ear canal, their ears get plugged up with wax frequently. Is that something pretty common, I'm sure?
Oh, that is very common. I'm sure the gentlemen here see it lots and lots as well. We clean them out in the office for people. Also recommend that at home you can buy commercial drops to put in on a regular basis. Ears are supposed to be self-cleaning, but some people just seem to have sticky wax.
Sure.
And you can buy over-the-counter eardrops to use regularly, or you can just use warm sweet oil or olive oil 3 to 4 drops in each ear
Great.
on a regular basis and hopefully not have a problem.
Well, thank you very much. Well, our time's up. I'd certainly like to thank this evening's panelists, Dr. Todd Freeman, Dr. Jonathan Glickstein, and Dr. Vicki Heren, and our medical students, Sarah Frisch, Leah Kay, and Laura McDowell. Our next program will be on December 12th, when Dr. Ruth Westra will be hosting a show on women's health. And our panelists will be Dr. Colleen Evans, Dr. Jolene Finken, and Dr. Melissa Stank. Thank you for watching, and good night.